COVID-19 pandemic.
Kung hindi natin sasabayan ng contact tracing ang ating pagtetest at hindi natin matitrace ang bawat taong nakasalamuhan ng ating COVID-positive patients, hindi natin maaagapan ang pagkalat ng sakit na ito.
As restrictions and quarantines are lifted, where are we on the speed and scale of testing?
We are also ramping up our capacity to test more broadly, to take a fuller and more accurate picture of the spread of COVID-19 in the country.
What are the challenges?
It's about the totality in testing, the high cost of testing. And we were requesting them to put a ceiling kasi obligasyon ng departamento maglagay ng maximum price ceiling.
Ang pinakamalaking pagkukulang niya ay ang hindi pagkakaroon ng mabilis na desisyon. Hindi niya pinayagan itong mga mass testing kits na gamitin kaagad kahit na may FDA approval sa ibang bansa. Kung hindi tayo hahanap ng isang kapitan na maaaring magbigay ng tamang gabay sa atin, baka mas lalo tayong mapahamak.
And how close are we to achieving our containment and mitigation goals as we move forward in this brave new world that we live in? This is a CNN Philippines special presentation, Just the Facts.
What can data on testing tell us about the coronavirus pandemic? We'll help you understand the facts and the figures.
We'll also help identify the issues and the hurdles that may be getting in the way of the country's efforts to fight COVID-19. I'm Dr. Freddy Gomez.
And I'm Pia Ontiveros. You can't fight a virus if you don't know where it is. That is from the World Health Organization's Director General. It was on March 12 when he declared the COVID-19 outbreak a pandemic based on the speed at which the virus was spreading and the scale of transmission.
And after that, one country after another started lockdowns and quarantines, followed by testing, tracing, and treating patients to break the chains of transmission.
Doc Freddy, testing is key. Joining us now is the country's testing czar, Vince Dizon. Welcome to the show, Vince. The World Health Organization says the ideal scenario is to test 1% of the population. That would mean about 1 million people here in the Philippines. So two basic questions. Where are we on our testing capacity and what is our goal?
Okay, I think we had some.
All right, we're going to try and get a better line.
Well, we're trying to adapt to the new normal. We're getting Vince back on the line.
Wait, Sir Vince, hold on. Nakamute.
All right, we have Vince Dizon with us, the country's testing czar. Vince, are you back online? That is the problem with this pandemic. And communication lines, Vince Dizon is still joining us, and we're hoping for that line to him right now. So do we have him?
Well, we're waiting for him, Pia. What was the question that we had addressed for Vince for the viewers?
That's right. Well, the question is because the World Health Organization is saying that the ideal is to test 1% of the population. The Philippine population, 110 million. So that's a little over 1 million. And of course, what we need to know is where are we on our testing capacity and what is our goal? And can we do that? Can we test a little over 1 million people in this country? That is a question that we need to ask Vince Dizon, who is the country's testing czar. He is a deputy implementer of the anti-COVID efforts for this country. Freddie.
Yes, that is no short order at all. Trying to test 1 million people is definitely a tall feat. That is definitely a challenge. But as earlier as March, there was already some set goals on how many people we were hoping to test per day. And again, those goals were set based on trying to be able to get that 1% people being tested. apparently now, I think there has been many challenges in order to achieve that goal, but the country and the government are still getting there. Now, what would be the importance? What would be the importance of trying to get all these people tested? Well, one thing, as we all know, testing or trying to be able to get enough tests out there will be able to give us some eyes on exactly where this virus is. What kind of situation are we actually looking at? Because as we all know, we cannot see the virus. So having people tested, the right people being tested, will give us a lay of the land, if you may, Pia. It will give us, the government, as well as the doctors, an idea on how much this COVID-19 has infected the Philippines, has taken charge. Because if we don't have an idea on where this virus is, it would be difficult on what actions to take after that. Pia.
Well, Doc Freddy, we have Vince Dizon already on the line. He is the country's testing czar. Vince, welcome to the show.
Thank you very much, Pia. My apologies for the bad connection earlier. As I was trying to communicate earlier,
okay. Not your fault.
We were able to increase our testing capacity from roughly around 5,000 tests per day capacity in April to now at 32,000 testing capacity as of May 26. And this has been a result of a partnership between the national government and the private sector. And now, from just 5 labs in March, we now have 48 labs, 31 from the government and 17 from the private sector.
Those are good numbers, Vince. We are definitely going in the right direction. But given all that data, are we still on track to conduct mass testing or even widespread testing?
I think the proper term to use is we are now able to expand our targeted testing strategy. Because the difficulty in talking about mass testing is the implication is you have to test everybody, which is not the case. No, you really need to test just a percentage of the population, especially in areas where the incidence of the spread of the virus is quite high. Say, for example, the National Capital Region. I heard you earlier, you're absolutely right. The goal is to test about 1%, which is right now the global benchmark for testing for COVID-19. 1% of the population, or about 1 million plus people, mostly in epicenters like NCR and other areas with high transmission.
Vince, are we going to be able to do that? Are we going to be able to test a little over 1 million people? And what is our target date for that? How soon should we be able to do that?
We're confident now that we have the capacity because it all starts with that. We can't talk about increasing or expanding our testing if we don't have the capacity to do that, which we didn't have in the early months of our battle against COVID-19. However, now we're confident we have it, and we think we should now be more aggressive in expanding our test strategy to more people, especially in epicenters like Metro. So yes, we're confident, and because we want to expand our capacity more so that we can test faster and test more in the coming months.
Vince, at the onset, the government
a while ago,
announced...
Vince, you said we have 48 labs.
Go ahead, Pia.
All right, Vince, earlier you were saying we have 48 laboratories,
yes,
31
48.
Government, 17 private. Yung 31 government, where exactly are they? National, local, regional locations?
Okay, they're scattered all over the country, Pia. A lot of them are in Luzon, and I think rightly so, because most of our cases are in Luzon. Through the Department of Health and the RITM, they have been able to accredit more labs in Visayas and in Mindanao. And we will continue to do so in the coming months.
At the onset, Vince, the government announced the purchase of around 900,000 PCR test kits and around 2 million rapid test kits. Amid the controversy surrounding these rapid test kits, why do we have so many of these rapid test kits?
I think the controversy stems from a misunderstanding of how to use these various modes of testing. I think rapid test antibody test kits serve a different purpose compared to a PCR kit. No, a PCR tests for current infection. It tests whether you are currently contagious or infectious, whereas the rapid antibody tests for antibodies. No, and I think what the DOH has very well done in the past couple of weeks and months is that it has developed a very clear protocol of how to use these two kits together. No, and especially in the DOH memorandum for return to work, which becomes very relevant now that we have declared many parts of the country under general community quarantine, and while we continue to slowly relax restrictions, these protocols using both antibody testing and PCR testing come to fore, but we have to use them within the protocols set by our Department of Health. So they are not independent of each other. I think that is where the confusion lies, when people start thinking of them as independent. But the DOH protocols have clearly shown how to use both of them.
And there are two types of COVID-19 test kits. The PCR, polymerase chain reaction test, which is currently the gold standard for testing the presence of the virus. Then there's the lateral flow rapid test strips, or simply known as rapid tests, which identifies the presence of antibodies for COVID-19. And as we mentioned, there's been a lot of controversy on this. So we want to show you the difference between the two types right here.
Vince, as we know, not all tests are created equal. What factors are taken into account to determine which one to administer to a patient?
Well, it depends on what we're trying to do, Pia. If we are looking for people who may be infectious and therefore may be infectious to their families or to their communities, the only test kit that we can use that we have very high batting average of making sure that we get the correct result is the PCR test kit, no, which is the gold standard in trying to find current infection. But if, for example, we want to understand the spread of the infection in the community, then we can do what they call a serosurveillance survey or seroprevalence survey. And for that, we use antibody kits, just like what the other countries are doing.
And as we know, ramping up testing will help us better understand how the virus is spreading.
Absolutely, absolutely. We have no choice but to really aggressively ramp up our testing. And it all starts with capacity, which we are trying to do. We're hitting our targets, but we're not happy. We've got to expand testing even more and expand actual testing per day a lot more.
So Vince, what are the other challenges that are getting in the way of ramping up this testing?
One of the major challenges is dealing with the difficulties in the global supply chain of laboratory supplies. As you know, the entire world is, struggling to purchase supplies from the entire globe. Right. And the Philippines is in the same boat as the other countries. But this is something that we have tried to address. I think the president's very strong foreign relations with many countries that manufacture and produce these supplies has helped a lot in allowing us to get a steady supply of these very important commodities as we further expand our testing. So we are trying to resolve this, and I think we will have a steady supply coming in very, very soon.
Yeah, we need to resolve that because we need to test a little over 1 million people. Well,
Yeah.
Vince Dizon,
The
thank you
other
very
thing,
much for joining us in the
yeah,
program this
thank you.
evening.
Thank you so much, Pia. Thank you.
Yes.
Thank you.
You wanted to add something? You were saying the other thing.
Another thing is
All right. This is a
personnel.
CNN Philippines special president.
Sorry.
This is a CNN Philippines special presentation, Just the Facts on COVID-19 testing.
When we return, we'll look at the costs involved in the supply chain management. We'll be right back. You're watching a CNN special presentation, Just the Facts on coronavirus testing.
That's right, Doc Freddy. We are talking widespread testing that a country needs to do in order to safely reopen the economy amid the COVID-19 pandemic. Are we there yet? And if not, how do we get to that point of care that is critically needed?
Gobyerno, may proseso na pag-modified quarantine, may mga lugar, pati may mga tao na exempted na sila, so they can work. But ito ilagay ninyo sa ulo talaga ninyo, ha? Sa conscious mind ninyo palagi. Ang COVID ho, nandito pa. Bantay kayo dyan. Do not be reckless. That's the word. Huwag kayong masyadong pabaya na basta sinabi ko sa inyo, alcohol, hugas kamay, mask. Maglabas kayo, take all precautions para walang sisihan.
Joining us now is Health Undersecretary and Spokesperson Maria Rosario Vergere and Dr. Rio Magpantay. He's the head of the Epidemiology Bureau of the department. Thank you both for joining us.
Thank you also for inviting us.
First, to Undersecretary Vergere, what process did the DOH follow in procuring 900,000 PCR test kits and the 2 million rapid test kits?
First, we did not procure the rapid test kits because we are not allowed to procure rapid test kits based on the Universal Healthcare Law, which states that if we do not have a positive recommendation coming from our Health Technology Assessment Council, we are not allowed to procure coming from DOH budget.
Could you take us through the procurement process of test kits and machines?
Well, when we procured the machines, actually it was not us which procured the machines. We prepared the specific details of this, the purchase request, where it was assessed and evaluated by our National Reference Laboratory based on their expertise. They did market analysis and they had to identify these machines that were compatible with the existing processes that they are using, because we wanted speed in what we are doing. So we wanted, and they have recommended that this kind of machines be procured so that we will be efficient in our processes.
Yusek Vergere, this is Pia Ontiveros. Ma'am, you did procure 900,000 PCR test kits. Is that accurate?
Yes, ma'am. That is accurate.
All right. But itong PCR test kits, those are not the SanSure test kits that the Omnibus Biomedical Equipment Incorporated offered to the government. Hindi po yon.
We identified 3 types of testing kits, which we have procured, because there are different types of RT-PCR machines that our subnational laboratories have. So it has to be compatible with the RT-PCR machines that we have.
Right. Okay. So, pero hindi po ito yung SanSure that was
There are some
being offered
SanSure
by
test kits that we
Omnibus.
procured. There are some SanSure test kits that we have procured because we also have some Sansure RT-PCR machines.
From Omnibus also, ma'am? The distributor, Omnibus?
This I do not have any information of because it's PSDBM which has procured all of these products that we have.
Yes. But before PS, the procurement service of the Department of Budget and Management does procure, doesn't the request come from the health department?
Yes, we we do the request, we do market analysis, we do our purchase request, and we submit it to PSDBM. But as to suppliers, we do not have any information for these suppliers.
I see. When you say you don't have any information for these suppliers, so because one of the undersecretaries of DBM was talking about Omnibus and how there was that offer made by Omnibus for the Sansure test kits and the extraction machines, for example, which are very highly priced. So hindi po galing sa DOH yung request na yon?
We requested, as I've said, we have requested. And we also have indicated the different specifications of this request that we've had. But when it comes to suppliers, we do not have any information about that anymore because our process stops once we submit this purchase request to the PSDPM.
I see. So hindi po nanggaling sa DOH yung request na sa Omnibus bilhin yung Sansure test kits at yung kanyang mga machines.
It's the process of procurement when you do that even in PSDBM. So they do this procurement process where there are bidders, the suppliers would bid, and those with lowest calculated bid will be identified.
Mm-hmm. So walang kinalaman yung DOH sa supplier. So kung the DOH will just say, we want this Sansure test kit, bahala na ang DBM na maghanap kung sino yung magsusupply nun.
Yes, through the procurement process, ma'am.
Okay. Ma'am, of course, the controversy, grabbed the headlines for the last few days. And it dumating po sa punto that the president asked that the NBI come in and investigate this couple who owns this omnibus. It sort of overshadowed the news, no, on all this testing, the need for testing, and the importance and how crucial testing is in this fight against COVID-19. How does DOH look at this development?
Oh, well, the DOH is always open if there would be investigations. We do our work properly. We identify this type of specifications simply because this is a highly technical process. We need compatibility. We need compatible testing kits with our machines because we have had experience already that there had been a lot of operational delays if your testing kits and your PCR machines are incompatible. So we are open to this investigation if and when that thing will happen.
Mm-hmm. Just one more question on Omnibus, ma'am. Aren't they suppliers in the past of the DOH? Specifically, didn't they supply microscopes and blood bags for the DOH and or some of the government hospitals?
I do not really have any information about these suppliers because I am in a separate cluster than our admin and finance. So if the supplier has been supplying with DOH before, I do not have that information.
All right. Doc Freddy?
Yes, thank you very much, Dr. Undersecretary Vergere. Do we have Dr. Magpantay on the line as well?
Yes, thank you.
Thank you very much. Dr. Magpantay, on May 19, Senator Drilon questioned and asked Secretary Duque about the cost of PhilHealth's COVID-19 test packages. He said they were anywhere from 2,700 to 8,000 plus pesos each, when in fact the cost of the test kit and processing are only about 1,500 pesos. Couldn't this pricing discrepancy been handled better, especially given that we're in a pandemic right now?
Yeah, I think PhilHealth and DOH, of course, with Secretary as the Chairman, has discussed this already. Although it's not part of my expertise to discuss this right now. because I'm an epidemiologist, and most probably this could be better asked to a person who's very much knowledgeable on field health packages. I'm sorry.
But in your opinion, could things have been handled better since all of these test kits are definitely a need right now by by a lot of people?
It could have been handled better if there's been a lot of discussions on this before the laboratories started charging. But as I have said, I don't think this is my expertise to talk about this. Thank you.
Thank you. Yeah.
Undersecretary Vergeire, I wanted to ask you, before we started the 6 p.m. newscast, sanay po kasi kami that the DOH releases the day's figures in the late afternoon, and that becomes part of our headlines, no? But today we were told that you were going to be releasing the figures at 8 o'clock this evening, and that you were still validating some of the cases, some of the reported cases. What happened? This is just a little bit unusual. We're just curious.
Yes, we tried analyzing our numbers because, as you have seen, for these past days, we have had a slightly increase in the number of cases. Like we had 350, we had 380, and then yesterday we had 539.
380.
Yes,
500.
going back to this number of cases, we tried to analyze, and we saw that the validation of these numbers, the validation has given us this effect on our numbers. So we explained in our presser this afternoon that for this 539 that we got as numbers yesterday, only about 109 were fresh cases, and about 400 were late cases. So this is as a result of the aggressive
Okay.
validation that DOH is doing right now.
Yeah, so bakit late po ngayon yung release for today?
Because we are
there
going
more,
we are
lumaki
now-
ba yung bilang? It's more than 530?
Yesterday was 539. But for today, we are trying to reformat
Yes,
what
but
we
for
are
tonight.
doing. For our case bulletin for today, we are going to reformat what we are going to provide the public as information. So we are now going to show them what are the fresh cases and what are these late cases, so that it could be better understood by our televiewers, our citizens, and they wouldn't panic. Because as we have said in our presser, we are expecting that in the coming days, numbers will increase because of the aggressive validation that we are doing. And we would want our citizens to understand that there are fresh cases, those cases that has happened for these past 3 days only, and there are late cases which has happened more than 3 days ago.
Okay, so understandable kasi parang nakaka-alarma na nga kahapon, 530 plus. It sort of unnerved a lot of people. And in other words, ma'am, are you saying, well, 8 o'clock is just like 30 minutes away. Are you saying that the numbers will be more than 530? We're looking at what? 700, 800, 1,000? And then, like you said, no, para nga hindi magpanic ang tao, i-reformat na lang ninyo yung mga numero.
As of this time, the Epidemiology Bureau is still finalizing the numbers. And as we have committed, we will be releasing it at 8 p.m. tonight.
Okay. Baka si Dr. Rio can answer that question now. Is he still on the line? Dr. Rio? Dr. Rio Magpantay?
Yes, I'm still here. Hello.
Yes, oo. Since ang pinag-usapan testing, and syempre yung mga numero na nire-release araw-araw ng DOH galing po sa mga testing. So we just wanted to know, very interesting how Yusek Vergeire was explaining it, that you're reformatting the presentation so that you don't just present new cases in a lump sum mode, and you're going to break it up into two, the fresh cases and the other one, no? But can you give us an idea? It's just 30 minutes from 8 o'clock when you said that you would be releasing the numbers. So what are the new numbers for today?
We're still validating all of these numbers, the new cases and what we call the late cases. And by 8 o'clock, it should be ready. And I think Yusek Vergeire is also ready to announce that.
I see. Well, sana pwede i-announce within the show. I don't know if we can keep you that long, but maybe Yusek Vergere, you can come back a little bit later, no?
Let's see, maybe through phone patch if you like, because I still have to go back to the
Ye-
secretary after the meeting.
Okay. Doc Freddy, you still have some questions for Dr. Magpantay?
Yes, yes, I actually do. Dr. Magpantay, are you still there, Doctor?
Yes, I am still here. Thank
No,
you.
as we all know, we're going to be easing restrictions on the country pretty soon. And this is all to revive our economy. Amid the need for massive testing, who should be responsible for bearing the cost of the COVID-19 testing of employees?
Based on our discussions, I think the government must also have a hand in making sure that the testing through the PhilHealth will be paid through the laboratories. But this should be expanded testing, particularly. We are not into the mass testing scheme because the truth of the matter is the more fitting name should be expanded and targeted testing. And this would include, to achieve this, we need to expand the testing to include additional groups, but targets individuals who are at risk of getting COVID-19 infection. Who are these targeted and prioritized for testing? I think we have to emphasize that. These are the symptomatic and fit the case definition for a COVID-19 case. And these are those we classify as suspect cases also, apart from the confirmed cases, of course, that we have to identify. The close contacts who are symptomatic, followed by those who are asymptomatic. Close contacts are actually individuals who have been exposed to a confirmed case and may be potentially infected, and this includes those who have lived with, cared for, or attended to, traveled with, or transacted with a case. And of course, we have to make sure also that individuals who provided direct care to a COVID-19 case, such as our health workers, must be tested.
Now, Dr. Magpantay, when you say that PhilHealth will cover the test, does this include also the PCR test? Because as we all know, someone who has taken a rapid test and comes out positive will need a PCR test to follow.
Our gold standard is actually the PCR test. So these are the swabs are being taken to the different laboratories who are actually, of course, charging and based on PhilHealth rates.
Okay, thank you very much. Pia?
All right, just one final question for Undersecretary Vergere. Ma'am, earlier we were talking about the purchase of test kits, and I just wanted to ask, for those test kits that were purchased, do you have the information at hand as to how much these were?
We do not have any information about how much this test kits cost. I do not have that information.
I see. Okay, pero siguro naman it is not, hindi masyadong mataas yung presyo kumpara sa narinig na nga natin tungkol halimbawa sa Sansure test kits na dinidistribute ng Omnibus. Hindi naman siguro.
We really do not have that information because once it is procured, it's just delivered to the National Reference Laboratory, our ITM, and then we distribute it to our subnational laboratory. So we do not have that costing or the price of this testing kits.
Okay. All right. Well, Yusek Vergere, we hope to be able to speak to you later on in the show when the new numbers for the day are supposed to be released. I hope we'll have some time for that. We'll just call you back na lang po. But Undersecretary Maria Rosario Vergere of the DOH and Dr. Rio Magpantay, thank you very much to the both of you for being with us on the show. This is a CNN Philippines special presentation, Just the Facts on COVID-19 testing.
When we return, we'll look at the costs involved and the supply chain management. We'll be right back. Welcome back to the program. We want to bring you this time some of the containment and mitigation strategies in different parts of the country.
We'll be looking into the interventions, safeguards, and precautions in place so others can learn from them. We'd like to welcome to the show Baguio City Mayor Benjamin Magalong. Metro Manila will be under a GCQ, or General Community Quarantine, beginning Monday, June 1st. Mayor Magalong, kayo po sa Baguio City. Ano po yung gusto nyo sanang classification?
Good evening, Pia. Good evening to our televiewers. Are you referring to the contact tracing that we are now strongly
The Mayor,
implementing in the city of Baguio?
Mayor, what we're talking about first po ay yung classification. Dahil sa June 1, Metro Manila, GCQ na po. Sa Baguio City, you asked for a reclassification. Am I correct?
Yes. In fact, yesterday, I submitted an appeal to the IATF, and we're just waiting for us to transition from GCQ to modified GCQ, and we're still waiting for the official reply of IATF.
And your reason is that the entire Cordillera region, where Baguio City is going to be modified GCQ. Pero kayo, parang naiwan kayo doon sa GCQ, and yet you do have some testing labs already. You have very good testing, tracing, and testing and tracing, and that is why you are asking for that reclassification, right, Mayor?
Yes. In fact, the reason why we were requesting that we transition from to modified GCQ is because we have complied with the 4 critical parameters. One is we have a very robust contact tracing. Another is we have heightened our testing capacity. Third is we have building a strong health infrastructure and this is in coordination with the Baguio General Hospital Medical Center. And number 4 is that our people in the city of Baguio majority of them have embraced the new normal. There's a observable change in their behaviors, and I believe we're ready to go on modified GCQ.
Doc Freddy?
Yes, Pia, thank you. Hello, Mayor Magalong. This is Freddy Gomez. Where is Baguio right now in terms of testing?
Well, right now, if you look at our capacity 6 weeks ago, we only have 1 PCR machine, and we're doing the extraction of the RNA manually. Today, we have 6 PCR machines, and we have 2 automated extraction machine. And at the same time, we continue to train more medical technologies for us to be able to sustain the operation of the molecular laboratory. At the same time, we're also working together closely with a private sector, and hopefully they will be able to put up their own molecular lab in sometime in June.
Thank you. Pia?
Well, that's good to know, Mayor Magalong. You are, well, not just in tracing but also in testing. You're way ahead of so many other areas in the country. Was it difficult to get that accreditation from the DOH? What were the challenges along the way, just so that you could put up those laboratories?
Hindi naman kami nahirapan considering the fact that initially the Baguio General Hospital Medical Center was designated as the testing center for the entire Northern Luzon. It's just that we had a difficult time getting more test kits. In fact, for the 6 weeks since we declared the ECQ, ang nakuha lang namin na test kit was about 17,000. And if you look at the population of Northern Luzon, inabot kami ang population namin is around 10.5 million. Mabuti na lang gumalaw kagad sila Secretary Galvez at si Secretary Vince Dizon. With that, immediately nakakuha kami ng additional na 10,000, and hopefully they will provide us the additional 20,000. Isa pa is because of the support of the private sector, nagbigay kaagad sila ng additional na mga PCR machines. And then 2 weeks ago, nung pagkatapos ng pumunta kaagad dito sila Secretary Galvez, nagpadala kaagad sila ng isang set ng equipment for our molecular lab composed of 2 PCR machines and one automated extraction together with the biosafety cabinet. Kaya from a testing capacity of about 700 a day, umakyat na kami ng mga 2,000 a day.
Right. Thank you very much for joining us this evening, Mayor Benjamin Magalong of the city of Baguio. This is a CNN Philippines special presentation, Testing in the Time of COVID-19.
When we return, we'll speak to a former health secretary who led our country's fight against SARS way back in 2003. Stay with us.
You're watching Just the Facts right here on CNN Philippines.
Our focus today is COVID-19 testing and how critically important it is. So with us this time is former DOH Secretary Dr. Manuel Dairit. You were lead. Hello.
Hello.
Hello, welcome to the program. Dr. Dairit, you were leading the country's efforts against SARS in 2003. What was it like back then, and how would you compare it with what's going on now with today's pandemic?
Hi, Dr. Freddy and Pia. In 2003 with SARS, it was also a very, very highly charged situation. Back then, there was also a lot of panic, and there was a lot of concern. And in fact, businesses closed also, and airlines were flying empty. The big difference really is that SARS essentially was not as contagious as COVID-19. And we were able to monitor the entry of infections to the Philippines, and we were able to prevent their community spread. All told, there were 14 cases that entered, but we were able to stop them from spreading. And in one place where there was a threat, we actually quarantined a whole barangay in Region 1 in Pangasinan and observed them for 2 weeks, if I recall correctly. But the difference with COVID-19 is that compared to SARS, COVID-19 has asymptomatic spreaders. In fact, they estimate that maybe as many as 30% could be asymptomatic spreaders, while SARS spreaders were usually symptomatic. So that is the big difference. The other big difference is that SARS really had a higher mortality rate. But the difference between COVID-19, which is a lower mortality rate, is the number of COVID-19 cases far exceed the number of cases of SARS in 2003. For example, worldwide, there were 8,000 SARS cases, 800 deaths. That's the total worldwide. Whereas for COVID-19, we already have 5.6 million cases worldwide and so many 100,000 deaths.
That's true. Pia?
Yeah, Secretary Manolet, since tonight's show is focusing on testing, can you tell us what are the differences between the SARS 2003 experience and the COVID-19 pandemic 2020 experience?
Very, very big difference, Pia and Doc Freddy. During SARS, we didn't have any tests. We didn't have any tests. We were going by clinical symptoms and x-rays. And therefore, we were going with what the most likely symptoms were of a SARS case. And on that basis, with a history of exposure, we would then quarantine our suspects. Whereas with COVID-19, you have the RT-PCR and you have antibody tests. But even if you have these two tests available, they're not perfect tests. You do have false positives and both false negatives, both for RT-PCR and antibody tests. And therefore, it's very, very difficult also to track the infection given these two tests.
Yeah. Well, Secretary Manolet, of course, we have so many challenges when it comes to testing. And I remember very well at the beginning of the pandemic and at the beginning of the ECQ, palaging sinasabi ng WHO, DOH, IATF that let's set aside the notion that we can test everyone and then let's just act as if we are all COVID positive. I remember that very clearly because for a while there was that panic, no, among people na how do I know if I have it, no, and I need to know, I need to get tested, diba? Can you talk to us more about that?
Yeah, Pia, that actually makes a lot of sense. What it actually says is that everyone should think of himself or herself as a possible patient with COVID-19 or a possible spreader of COVID-19. So regardless of whether you are tested or not, you should behave accordingly and not be careless and spread the infection and get yourself infected. So it's very, very important for every citizen to understand that, because you never know how you could get infected in a situation where you have community spread. We all will need to practice social distancing, but we know that this virus is contagious and you may inadvertently lower your guard and get infected. But we know how the disease is spread. We know how the virus is spread. So we have some control of that by wearing masks, by keeping our distance from people, and actually from staying away from mass gatherings. In fact, one of the things that we all want to avoid is what they call super spreading events. Events where people come together and there's an infected person, perhaps asymptomatic, perhaps symptomatic. But in that event, a number of cases could actually occur because the transmission has actually spread to them. And so, regardless of whether you can test or not, if we were able to do that theoretically enough, we should be able to slow down the spread of infection.
Well, Secretary Manolet, of course, by June 1, Metro Manila GCQ already, no? And you get the sense that there might be some people who think that, okay, we can relax already kasi mula ECQ, mag-GCQ, parang magda-downgrade tayo to GCQ, no? But the way you're talking, and so many doctors have said it again and again, WHO, DOH, IATF, na we cannot let our guard down. But how do we make that appeal to people so that even if by June 1, GCQ tayo, hindi magbabago ang behavior? Because there is such a thing, Doc Manolet, hindi ba, as peer pressure or among very close friends, family, di ba? You expect that you will see each other. How do we explain that? How do we convince people?
Yeah, this is the whole challenge because we are all social beings. And we can only keep persuading people. We can only get them to understand that if they get infected, they will be very lucky if it's a mild infection and they can walk away from it. But if they're unlucky and they get critically ill, they could themselves be hospitalized, perhaps die. But before they get hospitalized, they could spread it to other loved ones within the household or among their friends. So it's convincing people about the dire consequences of being infected and spreading the infection. This is the only way we can actually get people to behave accordingly. But we know that people have different concepts of their own personal risk. We know that people, particularly young ones, may feel invincible. We know that there are people who say, I don't care. And I guess this is the challenge. And we just have to keep persuading people to behave in a way that they don't get infected or spread the infection. Of course, we can coerce them, but we know how coercion works. After a while, they hide from you, they passive aggress you, and in fact, your coercive methods may eventually all be short-lived. So what is needed now is really a very, very profound as well as pervasive communication from government and really from private sector and from even households that sends this message to everyone. And this is the only way that I think we can actually eventually slow down the infection and not spend so much money doing what we have to do to test as many people as we can.
Okay, everybody, you heard that straight from the former Health Secretary, Dr. Manolet Dairit. Dr. Dairit, thank you very much for joining us this evening.
Thank you very much,
Fighting
Pia and
a
Dr.
pandemic
Fred.
is a tall order, but it is essential to have the right information, which can only be achieved through testing.
That's right, Pia. And, you know, Dr. Dairit mentioned it, and I can't stress it enough that this virus, all of us have to do our part. So the social distancing, just back to basics, the social distancing, the hand washing, all of those are important for us to basically get through this. And the goal is definitely to ramp up our testing capacity and capability, because it's the pathway to slowly but surely reopen the country. I'm Dr. Freddy Gomez.
And I'm Pia Ontiveros. Thank you for watching Just the Facts right here on CNN Philippines.